Hi, I'm Dr. Ben Newman. I'm a coronavirologist with 25 years of experience growing and studying coronaviruses. And I'm here to answer another question. So, this is one that came up in the discussion of the previous video on Governor Abbott's new order to lift the statewide mask mandate in Texas. And some of the reasons why I thought that was probably not going to be a good idea. So, the chief argument in favor of this, and the one used by the governor himself, is that individual liberty is at stake. And by exercising individual liberty, we take individual responsibility. And basically, that's the principle that freedom's built on. And I think that's a discussion that a lot of people are having right now. Let me give you the best I can understand it public health perspective on this. So the problem is this is miscasting COVID-19 as an individual risk. Because if you think about it, and I think this is a big mistake that a first-year public health student would not make. If you think about it, you can't get COVID-19 from yourself and you can't give it to yourself. So the virus has to come from someone else. And we know of cases like that prison up in Vermont where even a person wearing a mask, if exposed to enough of the virus, SARS-CoV-2, can still become infected. So this is a collective risk, and essentially those are hard to measure. So the other idea, the sort of just sort of free will, free market idea, would be that individuals should be able to accurately assess public risk. Now, there's a couple reasons why that's not the case in Texas right now. One of those is that the data is not available. Now, I mean not available to anyone, including the governor right now, as far as I'm aware. So Texas had an ice storm about 2 weeks ago, and during that ice storm, there was a big drop in reporting. And the Texas DSHS actually put out a statement saying that the number of cases was going to be abnormally low, just like falsely low. And a way that you can tell this by looking at the data. So if it was just testing, you would say, okay, testing drops off and then comes back up and it's fine. There is a giant decrease. It's just a dip where the deaths are right here and they go down to 0 and then they come back up again. And the time where they're at effectively 0 is the full length of the big winter freeze. So people don't just stop dying because everything gets cold outside. I mean, that's fairly obvious. So there's missing data here. And normally what you see in Texas is that every month or so, the DSHS will come back and they will gather up as much missing data as they can and they'll put it all into one day. Usually they will dump it on a Friday night. And then you'll see one data point that's enormous. It's got 50,000 more cases than the ones either side of it. And you'll say, what the heck happened there? That's all it is. It's just inefficiencies in reporting, and they collect them up. They try to keep things that happen on the day attached to the correct day. And so we still have not had that correction. We have not seen that spike, which means that they are still dealing with and processing missing cases. And probably a considerable number of them, judging by the sort of missing chunk from all the curves, where it was, a straight line, but then there's a great big canyon in the middle of it. So the data don't exist for anyone to make an accurate collective judgment of how the state is doing in terms of COVID-19. And then I think just the other part of it is that it is very difficult for just regular people to do everything they're trying to do ordinarily, like all the normal stuff in life, and then read up a bunch of coronavirus papers and follow the latest developments in epidemiology and, laboratory science. I mean, that's not something that we ask anybody else in any other field to do. And the reason why we don't ask that is because there's no way it's going to work out. You can say, yes, you must be a master in all aspects of this new thing that you don't know about. But it doesn't happen. Can't happen, I think. Yeah. So, yeah. And on top of that, economists would tell you that humans are just generally bad at estimating long-term risk. We're better at short-term risk, considerably better. And we tend to vastly overweight short-term risks when making risk-benefit calculations. Like, what's it going to do right now is a much bigger priority unconsciously, just in the way that people work, in the way that I work, the way that everybody works, compared to what's going to happen, what's the effect of this thing a year on or 6 months on. So those are some of the ideas. And I think the other part that ties into this is that in the governor's speech, anyhow, I haven't seen the executive order yet, but in his speech, he mentioned that the people in charge, so if cases rise above a certain threshold, which is arbitrary and pretty high, then local county judges will be the only ones with the authority to actually impose any kind of restrictions. Now, I've met a few judges, and maybe you have too. Any of those judges seem like they've got a ton of free time to be perusing the latest journals and all the latest, keeping up to date with everything new in COVID? Yeah, I don't think so. But every place in Texas, and for that matter, every place probably everywhere, is under the jurisdiction of some kind of Department of Public Health. Now, this may be at the national level, state level, county level, or local level, city level. And you will find places where there are all four of those layers in place. Place as small as Texarkana has local, county, and state, as well as I suppose you could say the CDC is like a national level, public health organization. So with all of those people who are trained and whose literal job it is to understand COVID-19 and the implications of mask mandates and things like that, with all those people already on staff, already doing the job, why bar those people from the decision-making process and leave the decision to a person who is frankly already probably overworked and who is an expert in jurisprudence, not an expert in public health or virology? So deliberately putting the things in the hands of non-experts when they are very important decisions, with no obligation to talk to or listen to anyone, basically with inside or just sort of training or knowledge about the subject, seems like a very very bad thing to me. Yeah, it just seems like there are better ways to do this. Essentially, the problem is, I think, analogous to secondhand smoke. So that is banned, at least in Texas. You're not allowed to smoke inside most buildings. And I think this is the case in most of the country, if not all of the country. I think this is the case in many countries in the world. These issues of individual liberty are definitely not only Texan and not only American. These are human issues, very much so. Just flavored by whatever the local context is at the moment. So in the case of secondhand smoke, we take very severe precautions. Police are allowed to fine people. Potentially even, there could be even criminal penalties in some cases for allowing this to happen. Same thing with seatbelt laws. Now, seatbelts are an individual protection. The seatbelt is protecting the person who is wearing it and not really doing much to protect anybody else from anything. And even so, it seems important enough and a big enough risk, because the risk is death, that we would normally take that precaution, even though on most driving trips there is no accident. There is actually probably no cause for the seatbelt to actually be engaged. It's pretty rare when it happens. So there are clearly situations where the collective good and even the individual good is regulated at the state or national level. And generally, I think this happens in places where there's sort of a gap between what people want to do and the sort of the best way to keep everybody alive so that they can do all the other things. It's trading a small liberty for all the other big ones that make life worthwhile. That is my non-political scientist view, my scientist's view of what's going on here and of some of the fallacies behind this latest order, which I see has already been replicated in Florida. Yeah, science is a thing that humans have come up with. It is simply what works and what's been tested enough times that you know it's going to work and that you are no longer fumbling around in the dark when making decisions. That's all science is. It's things that work beyond a mathematical, reasonable doubt. And to turn away from that or even make policies that are contrary to it, possibly anti-science, just does not seem to me like a productive thing to do. It's very much self-harming. So there you go. That's the other half of this one. You can watch the other one if you like. I'm sure it's somewhere on your screen at the moment. Thank you very much. This is once again Ask Dr. Ben, and a couple people didn't really ask. They left rotten comments, and that's fine. It's a discussion, needs to be had, and this is my way of discussing it with as many people as possible at one time. Yeah, thank you, YouTube, I guess. Yeah. Thank you very much, and please stay safe.